Office Knockers. My name is Cassie. I'm going to be taking care of you today. I'm going to be changing your central line. Can I get you to verify your name?
Barbara Knockers.
Okay, and what's your date of birth?
2/14/1984.
Okay, beforehand I went ahead and washed my hands and at the beginning of the room and put sterile gloves on. Put clean gloves on. I'm also checking to make sure she doesn't have any allergies. I have looked on her medical record and I'm verifying that on her armband. After this, I'm going to start removing her dressing. I have looked on there and I see that it is the date. It's time to change it. And I also see the date on there and I see NR for Nurse Ratchet. So I'm going to start from the outside and I'm going to remove this dressing. And you can, on the video, he made it to where he just threw it on the ground. We're just going to do it to where it's a little cleaner. So I opened this bag, got it in here, throw my stuff, discard it. Afterwards, now I'm going to, I've inspected it. I've looked to see if there's any kind of infection or discharge, visually, whatnot. I don't see anything. Everything looks great. It has been well maintained. I'm going to now change into my sterile gloves. So I'm going to take these off. So with this, I'm going to make sure that this is, because this is going to be a sterile technique. So I've got a sterile filled. Now, you can put her mask on at any time. You can do it before or whatever. I would have normally done it before, but on the spreadsheet it says to do it. So I'm going to have her turn her head, but she can't turn her head. So, but she does have a mask on. I'm now going to put my mask on. Still going to this is going to be sterile technique. I'm going to grab on the inside. Don't touch the outside. And I think these gloves never work. Normally they don't go on this hard. Okay, so this one's clean. I can pick this up on the outside. I can't touch this one to this because it's clean or sterile, I'm sorry. Perfect. Okay, now I'm going to want to do my filled. Remember, you've got your ends all the way around. And then in the video, he started removing stuff and setting it out. He does not want us using the iodine swabs. I'm going to go and set everything out in here. Okay, so next I'm going to want to cleanse the site. I'm going to use chlorhexidine. So when you're cleaning the site, you want to make sure this is like going to be your skin prep and all that. You're going to make sure that you look and see if the lines and stuff have not migrated. You've got your 2 lines and your 1. And you're going to want to make sure you clean from the inside out. While remaining the sterile technique. And I've also, when I checked the bag, I made sure that the expiration date on all this stuff is good and everything is intact and looks great. So after I've done my skin prep, I'm going to then cover the site with new dressing. And I'm going to want to make sure I initial it after I put the dressing on. And this is really hard to do on a mannequin because it's so hard. I'm going to want to initial it. So I'm going to make sure after I've done that, I'm going to loop the tubing upwards to the shoulders. It's already done. The reason why we do that is it's to prevent pull on the hub. And I've, of course, labeled date, time, and my initials on there. And this is going to be a triple lumen, so even though we just have the 1 black, just for purposes. So next I'm going to flush. When I flush it, I'm going to flush the proximal. The reason why I flush is because it's got the least possible for bacterial contamination. So I'm done with all this. So I can just take this out and chunk it. Now it's really important to have alcohol, even though it wasn't in our kit, to have alcohol swabs, because you're going to want to make sure anytime you start messing with the central line, you cleanse the site for a full minute. I can't really push the saline because it's not real. But I'm going to want to cleanse it. Again, it should be a triple lumen for a full minute. Once I'm done, I'm going to want to flush 10 cc's to make sure the line is patent and there's no resistance. Okay, I did it for a minute. It's good. Everything looks good on it. So after that, I'm going to continue with the blood draw, and I'm going to also do 10 cc's. So pretend like this is another syringe. It's been cleaned. Pull it. 10 cc's. Did great. So then I'm going to get my thingy, my just normal flush, and I'm going to put it back on, and I'm going to reflush it 10 cc's. Did great. Everything looked really good with this dressing. The wound, in the line, there's not any kind of drainage. There's not anything else going on. Miss Knockers, you did great today. Thank you so much for letting me change your dressing. Is there anything else I can get for you?
No, I don't think so.
Okay.